Hi everybody, this is a video about a podcast episode that I want to share with you, something that I'm excited about. Just before I jump into the video, if you don't mind taking a quick second to either like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the podcast episode that I'm excited about is actually a podcast episode of the Overcoming Chronic Illness podcast, my podcast. And I just launched the episode on Sunday, just a few days ago. And it was an interview that I did with a chiropractor from Kansas City, Missouri. His name is Dr. Jabin Moore, and you can access that podcast episode on any major podcast platform or minor podcast platforms as well. It's also my YouTube channel if you want to watch us talking and have a visual component as well. But I just wanted to talk a little bit about the podcast episode because I was very inspired by the episode. So far, all of the conversations that I've had with various guests, I've enjoyed all of them and I've learned something from all of them. But one of the things that I was really excited about that Dr. Moore was talking about is his use of something called neurofeedback in his practice. And neurofeedback is something that I've been aware of for quite some time, but honestly, when I looked into it previously, the equipment and everything to get it set up was so expensive that it just wasn't something that I thought would be it wasn't the best fit for my practice essentially. Because of course, when equipment's really expensive, then when we buy the equipment, then the price for folks to access that resource is expensive and just didn't seem like it was in the cards. But I was excited to learn that after I got excited about the potential for neurofeedback that might help my own patients, I took another look into it, and it turns out there's quite a few companies out there now that are just adding more competition, I guess, to the playing field, and therefore prices are going down, and it's something that I'm in the process of actually bringing into my practice. I was, again, so inspired by Dr. Moore, so very thankful for his time, thankful for his insight, and it was just exciting to hear about how neurofeedback seems to be an important part of his practice model. What I also really enjoyed from our conversation was just the approach that Dr. Moore takes to working with his patients. Now, for context, his practice, to my understanding, is largely comprised of folks who are suffering from complex chronic illness, so a perfect guest to talk about this topic on the Overcoming Chronic Illness podcast. And the approach that, paraphrasing, he says it best himself because they're his words, but my understanding from what he was saying is he takes this approach where he wants to make sure that the patient's environment is as safe as possible, so removing exposure to mold, mycotoxins, chemicals, things like that, and then also wants to make sure that the patient's internal environment is as safe as possible, and that could involve things like somatic experiencing, amygdala retraining, but then the neurofeedback fits in there as well, and then building on that layer would be nutrition and supplements and various treatments and this, that, and the other thing, and so it really it kind of just struck a chord in me where it's like, I find that it's sometimes challenging to address that, internal safety piece if folks have had a history of a lot of trauma, or they, have a lot of anxiety, or they have home situations or other work situations that are just not creating the most sort of safe healing space for them. I've certainly seen that as an obstacle to them getting well as quickly as possible, but it's also something where I personally feel quite limited in what I can bring to the table, because as much as I have my own mini amygdala retraining course that I pass on to my patients at no cost, or I have wonderful healthcare practitioners in my community that I can refer people to for trauma-informed therapy or cognitive behavioral therapy or things like that. Those are processes that of course take time, and finding out that there's a tool, this neurofeedback tool, that can be used to help with that aspect of my patient's care, I think was something I was really excited about. And so I've really kind of gone down a rabbit hole in the last little bit looking into this, and again, I'm at the cusp of actually bringing neurofeedback into my practice. So again, I think Dr. Moore's words can do it more justice than I can. And so please, if you're interested in this topic, and we talked about other things as well, but if you're interested in this topic, please consider listening to that episode. And the other, another little lead, I suppose, is that if you're interested in the topic of neurofeedback, because we didn't just talk about neurofeedback, it was a notable portion of our conversation, but not the entire conversation. If you're interested in more details about neurofeedback, I've, again, gone down a rabbit hole lately. I've been listening to different podcasts, looking at research literature, etc., talking to some of the companies that offer this type of testing and treatment and whatnot, and the resources to be able to offer that in our clinic. But anyways, a couple of the podcast episodes that I've listened to were with this PhD named Dr. Andrew Hill. He's based out of somewhere in California, I think maybe San Francisco, and his company is called the Peak Brain Institute. But he had a really great interview with Ari Whitten. Ari Whitten, he has a podcast called The Energy Blueprint. Highly recommend listening to that too. I think he's a really knowledgeable guy. Talks about mitochondria even more than I do, which, major street cred in my books doing that. And I can't remember which episode it was, but if you just search for Ari Whitten neurofeedback, it'll come up in his website, or Energy Blueprint, Andrew Hill. That's a really great episode to listen to. I think it's about I think she has a 2-part episode actually, and I think it's like 2 hours or something like that. But anyways, it gives a really nice overview of what neurofeedback is and what types of things it can help with. And I'm really excited to see how it's going to help my patients who are dealing with complex chronic illness, either in the early, like in the throes of hardcore complex chronic illness symptoms, or folks who are, already a significant portion of the way better, or also for folks who have largely overcome their symptoms and now we're working to optimize their health as much as possible. So excited about this topic. So I hope that you're interested in learning more about it. Again, we'll be posting more videos about it as I learn more about it and start getting some clinical experience with it in the next little while. If you yourself have had any experience with neurofeedback, or have any thoughts or comments about it, please do consider sharing that in the comment section below. As I've said before, I really enjoy reading the comments because I learn from them as well, hearing people's experiences and whatnot. And I would appreciate any feedback. If anybody has any questions about this topic or anything else, please don't hesitate to post in the comment section below. And otherwise, I will leave it there for now.